CBS News Chief Medical Correspondent Dr. Jon LaPook is joining us now. Dr. LaPook, in Princess Kate's own words, she says she's in the early stages of receiving preventative chemotherapy. What does that mean?
Yeah, I think I've been speaking to people over the weekend, and that word preventative was confusing. You know, the medical term we usually use is adjuvant chemotherapy. So what you're preventing is if there happen to be microscopic little cancer cells there that you can't see, and we don't know if there are or there aren't, you're giving chemotherapy with the thought of killing them now when they're most vulnerable, rather than giving it time to grow up and multiply and spread and form metastases.
And doctors said they found this cancer after this abdominal surgery. Is it likely to find sort of, cancer or signs of it after a surgery?
You know, it can happen when you, say, take out a surgical specimen and then it looks okay, and then you slice it up and you look in the pathology department and you say, oh, there are a few cancer cells there. These days, with all the scans that we do, often you do a CAT scan beforehand, for example. You see a mass there. And then during the operation, you're actually looking in the abdomen. You say, oh, look, I'm surprised. I didn't realize, but, there's cancer there. But that didn't happen here. So this happened after the fact. And to me, that was sort of something that said, well, maybe, we don't know the details here. Maybe that suggests that it was found in a relatively early stage because they only found out about it afterwards.
Dr. LaPook, the medical side of this is clear, or as clear as it can be. The psychological side of this is something you know a lot about. You've dealt with patients in general who have cancer diagnoses. They've got to fight it medically. What happens psychologically when you get news like this?
Yeah, I'm really happy for this question. And we're not talking about Kate Middleton right now. Let's talk about just my patient who happens to be diagnosed with whatever. It could be cancer, it could have a bypass surgery or whatever. They have the medical healing that happens at the beginning. And, that happens over a period of weeks or perhaps a little bit longer. And that goes over. But then weeks or even months later, especially if it's something that was really sort of surprising. They were in this fight-flight mode at the beginning. The adrenaline's going, the cortisol's going, and that dies down, and then they go back to their normal life. They could bolt up in bed, and I've had patients do this, 2 in the morning, and think in a cold sweat and think, wow, that was a bullet that just went by my head. And it can be destabilizing. Yeah. They can have anxiety and depression. And what I've learned to do, it has a beginning, middle, and an end. And I've immunized my patients. I say, look, this could happen. I warned them about it. And they've come back to me and said, thank you so much. It did happen. And then we talk about it. Sometimes I'll give them a little something to, relax them for just a short period of time. But that immunizing people and warning them this could happen has been really important in my own practice.
That's why you're such a great doctor. You're not just a practitioner, but you're a person throughout, and you help everyone come back to the humanity that's at the center of this. So thank you very much, Dr. LaPook. Appreciate it.